All right, nobody wants a sick child, especially for the holiday season, but the CDC says respiratory illnesses are on the rise right now, especially for kids under 5.
Yeah, talk about bad timing.
Yeah.
There is some good news, though. Mike Valerio explains why we shouldn't let virus concerns dash our holiday cheer.
After a huge surge of respiratory viruses in the winter of 2022, pediatric hospitalizations for those illnesses now are ticking back up. Despite the trend, Dr. Scott Hadland, a pediatrician in Boston, says he is not concerned by the numbers.
I would say most pediatricians and public health officials that are keeping an eye on this are not worried right now.
Health officials in Warren County, Ohio, said last week the area saw an outbreak of pediatric pneumonia cases. Respiratory virus activity is especially high in the southern and western U.S. But Dr. Hadland says
The pathogens or the viruses and bacteria that are involved in these infections are ones that we see every year. And so we might be seeing higher than usual rates, or we might see some areas that have small outbreaks of these. But this is standard, and this is quite expected, and this is all very manageable.
Meanwhile, China is experiencing a higher than usual rate of respiratory infection right now, which is causing some concern. But the head of the U.S. Centers for Disease Control and Prevention, Dr. Mandy Cohen, says the surge is all related to existing viruses.
We do not believe this is a new or novel pathogen. We believe this is all existing, meaning COVID, flu, RSV, mycoplasma.
In terms of fighting back, for the first time ever, vaccines are available for all 3 of the major fall and winter respiratory viruses. They are flu, COVID-19, and just approved this year, vaccines for RSV. In Los Angeles, I'm Mike Valerio.
Ooh, it is that time of year. The kids
I
come home from
know.
school. Wash your hands, wipe down the counter.
For sure. Yeah, take care of yourself.
Yep.